I'm going to introduce you to Skylar. Skylar runs the Glace Cryotherapy here. And I'll let him tell a little bit about what the process is, and we'll answer your questions as we go along. So, Skylar, you want to take over?
Thank you. Yeah, they did fantastic. Ran both of them in sessions, and they were pleasantly surprised how easy it was. And my name is Skylar Scarlett. I've been doing cryotherapy with my older sister, Brittany Scarlett, for almost 4 years now. And we started our hometown of Carmel. Basically got into the industry very early on. There was only 20 places in the whole country where people could go and do cryotherapy at the time. And so we got into this industry very, very early. So now here we are in Mountain View. And so cryotherapy, to sum it up really quickly, it's just a 1 to 3 minute cold therapy using dry air. And we do that to reduce inflammation. And most of the benefits we see is all related to the fact that we're taking your inflammation down every single time you come in to see us.
So how does it actually work?
So the science of it, which, my background is exercise physiology. That was my degree in college, and so I really love the science. Basically, the cold, dry air, it's nitrogen. It doesn't even go past your skin or penetrate deep into your body. What happens is, because your skin temp gets so cold, you have thermoreceptors all over your body on your skin, your brain actually reacts to this in a really powerful way. What happens is, it goes into fight or flight mode. And that's what we want. That's a really positive reaction your body can go through. What's going to happen is all of your blood vessels in your body, even your face, it doesn't matter that actually the nitrogen only comes up to neck level. Every blood vessel is going to tighten like this. It's called vasoconstriction. And it's really important because what that does is it closes your blood vessels so less white blood cells can leak out into your body. White blood cells are inflammation. And that's the whole purpose, is to reduce that inflammation. So that really sums up the science pretty quickly.
So is it safe to do? Obviously it is safe because Stan and I survived.
Yeah, it's very safe. I have seen over 10,000 sessions I've operated on. We had to go through 40 lawyers to come into this fitness club of 5,000 people, and none of them had any issues. So that gives you a pretty clear indication of how safe it is. We have a St. Louis Cardinals professional MLB pitcher here. He's, for the St. Louis Cardinals, they would never let him come near anything that would be unsafe.
Yeah.
So those are good examples. I mean, if you see professional athletes using this, you can know that with their trainers, their agents, all the money that these guys produce, they won't be allowed near anything unsafe. I've done 500 sessions. I think I look okay, right, after 500 sessions. So it's completely safe.
So does it affect your blood pressure?
It will spike systolic blood pressure a little bit. It's similar to exercise. It's only going to happen for about 10 minutes after your session. It'll go up maybe 10 millimeters of mercury. That's it. So not a big spike, but that is one reason why if you have, really high blood pressure, we do want to know about it. But really, the amount of people in 4 years that we turned away for high blood pressure would be very minimal. You'd have to have maybe 180 over 100 for us to say this is not something we would want you to do.
Perfect. And we have a question from a woman that was, can she do it while she's on her period?
Yeah, actually, she can. We just had that issue. A woman came in and asked my sister about it. She said, yeah, that's fine. My sister's done sessions, and it has no effect. But typically, people kind of tend to overthink it because they see a machine and they go, oh man, they hear these cold temperatures. But really, just think of it as cold, dry air. We're just doing the next level of any cold therapy.
So can you do it while you're sick? So if you have a cold or something, or
you can. I mean, if you're really sick, we prefer if you didn't come in. We still don't want to get our clients sick, but it won't make you any worse, and I don't think it'll make you better. 3 minutes maximum, right, in our machine. That's just not enough time to make you get sicker or get sick. It's not a very long time that you're in the cold.
Okay. So the next question was about cryotherapy. I know that they use it in surgical procedures sometimes to kill off the tissue, I guess.
There's cryosurgery, which
cryosurgery. Is it a whole different thing?
Yeah, a whole different
That's what they wanted to know, if cryotherapy does kill off any of your tissues.
No. I mean, that's cryosurgery, and we don't view what we do as medical. We view it as very therapeutic, but not medical, and we're not doctors. We never would claim to be. And a lot of the benefits are just simply the fact that we're bringing your inflammation down.
So are there illnesses that can cause issues with cryotherapy? Because we have a lot of lupus patients who also have Raynaud's.
Yeah, I think I have that same thing. I've done 500 sessions. And my sister would tell you, a lot of clients actually don't know they have it. That's fine. What we do is on our questionnaire form you fill out the very first time, you're going to let us know that you have it. It's on that questionnaire, and we're going to put probably 2 pairs of gloves on your hands and 2 pairs of socks on your feet. So we're just doubling up based on what we normally do. And you know, when you're inside, I'm always there right next to you. If you feel any discomfort, if you feel extra coldness, I hit a button, you come right out immediately.
Perfect. So do people need to get medically checked out before they come, or you just can come in?
No, I mean, here's how I would explain it. Do you need to get medically cleared to do a cold shower or to go in the Pacific Ocean when it's really cold? If you don't, you probably don't need to get medically cleared to do cryotherapy because it's cold therapy. Now, if you have any heart conditions or heart issues, that is something that we'd want you to go talk to your doctor first. Just because we're putting you in the machine for 3 minutes with cold temperatures, it can make the blood flow increase. So that's when we would want you to check with your doctor. Any heart issues.
We're going to bring in Brittany for a second because Brittany just joined us. She was helping another client. So my next question for you guys, since you're both here, someone wants to know if it helps with weight loss.
To answer this, we would never sell this as weight loss because I think that would be misleading. Weight loss is diet first, exercise second, and then little things after that. Now, cryotherapy, when you're inside, your skin temp goes way down because of the cold temperatures. When you get out, it's got to go back up to its baseline temperature. So in order to do that, it's going to have to take calories and burn them. So without a doubt, the science says it burns calories. How many? I wouldn't think it's a large amount. So don't come do cryotherapy strictly to lose weight. Focus on your diet and then focus on your training first.
Will it help with sleep?
Yes, we hear all the time actually from multiple clients that it helps with their sleep. Maybe, and it's funny because a lot of time they didn't come in for that reason, and they're actually finding that they are getting that out of all the best benefit out of everything is that their sleep is drastically improved. And I think that just has to do again with reducing inflammation in the body. Obviously, you're going to have less aches and pains throughout the night, less reasons to be woken up. So it definitely helps with sleep.
So the next one we kind of covered, but what are the risks? Are there any risks? I know it can be dangerous because we survived. So
yeah, I mean, the risks, as long as you're going to a place with well-trained staff that know what you're doing, that don't leave you in the crowd sauna by yourself, the risks are they're bare minimal. There's not really anything to be concerned about. You're talking to an operator at all times, so if you ever feel uncomfortable, you just tell us. We hit a button, you come right out. Like I said, we've seen so many sessions between us in 4 years, and right now there's maybe 600 cryo spas operating anywhere from 15 to 50 sessions a day. So if you do the math, there's a lot of people that are doing cryotherapy right now without any issues.
So are there any side effects to it?
We have not seen any side effects as far as only positive. So it's very, very safe. It's just that it's new, so people are unsure.
They're a little nervous.
Absolutely, but if you, like Skylar mentioned before, if you just take away all the science and the weirdness of it, it's just a cold therapy.
So is there any research done on cryotherapy?
There actually is a lot. It's all over in Europe because this therapy's been over there for quite a while before it came to the U.S. Interestingly enough, therapy was invented by a doctor to treat rheumatoid arthritis, and they were seeing such good results that rugby and soccer players over in Europe, they started to use it for recovery, saw good results, and then it came over to the U.S. But I'd say there's over maybe 100 studies in Europe, some showing great results, some showing a little bit of results, and there's mixed results. But the studies that they want here in the U.S. are very difficult to get because they want double-blind studies. If you know what that means, it means that you have to do cryotherapy without knowing that you're doing cryotherapy. And anybody who will tell you that's done it. When you're in there with the cold temperature, even if you're blindfolded, you're going to know you're pretty cold. So those studies are very difficult to get in the U.S.
So I can answer this because the next question is it painful? And it was not painful for me. It actually felt really good on my knee and everything else. How cold does it actually get in there?
Interesting question. Temperature ranges big time. It can go anywhere from just 50 below zero to as cold as negative 250 below zero. And when it comes to temp, as longer the machine's running, the colder it is. But when it is colder, it just means your session's probably not as long, maybe a minute or a minute 30.
Exactly. It's very tolerable, and it's a gradual type of cold. So we try to not even think about the temperature, because that starts sounding, very extreme.
Yeah.
Because it is obviously colder than you could get anywhere else, but it's much more tolerable than a cold plunge, an ice bath, jumping in the ocean.
Yeah, the
Not
fact
gonna
that
feel
it's
like that.
it's dry, that's the biggest thing that I love about
That
cryotherapy.
was
You
the
can
nice
do
part.
this and then go
Exactly.
run. You can go jog. You can go work out. You could never do that with an ice bath or any other cold therapy, because your muscle gets numb. It does not get numb with dry cold.
That's the coolest thing. Sorry. What about after surgery? So if someone has surgery and there's a lot of inflammation after the surgery, how long after a surgery do you have to wait? And can you do it after a surgery?
I think it depends on the surgery, most likely. And because you had asked about your upcoming surgery, and my advice would always be, when it comes to something a little bit more medical, get advice from your surgeon or your doctor, because we're not medical here. However, with that said, I think the sooner you can come in, the better, as long as you've been okayed for that. As long as there's no open wounds or sores, it's just going to help you recover from that surgery faster, because your doctor's most likely going to tell you to ice after.
Yeah.
This is the same thing,
absolutely.
only just quicker and a little bit more effective.
I think my sister makes a great point. We take every client, and every client is different and unique. They all respond to cold differently. They're all dealing with different issues, or they want something different out of cryotherapy. So we really put a program around the individual, because everybody is different. So we don't just say everyone comes in, you're doing this. We really want to find out what you're trying to get out of it, and then we go from there.
So have you ever heard of people actually decreasing pain medications because of the cryotherapy?
Absolutely, yes. So we should mention, I don't know if you already did, that we were doing this in Carmel before we moved up to Mountain View for 3 years. And so mostly our market in Carmel was pain management. And so we saw all the time clients were coming to us from rheumatoid arthritis clients, people with fibromyalgia, and any kind of Crohn's disease, any kind of inflammation, Lyme disease, were telling us that they were cut their medications in half. And we had people that tell us they hadn't felt better in years. So we just go off what our clients tell us.
Best results were autoimmune disorders. Our best.
Really?
I mean, phenomenal. Like she said, our best, one of our best results ever as a client has Crohn's disease. And she just felt incredible. We still stay in touch with her because she had such amazing results. And she never went past the minute 15 in our unit, which just shows us that you don't need to go a really long time to see results. She felt incredible. And then, as my sister touched on, we had a client with Lyme disease, and she brought me paperwork to me with her inflammation results, and they were way down. She was
Really?
ecstatic.
So is your whole body enclosed? Is the next question.
So your whole body except for your head is enclosed in there. So your head sticking out, the operator, which is usually Skylar here, talks to you the whole time, doesn't leave your side.
And then what is it? It's carbon
It's
gas?
nitrogen.
liquid nitrogen.
Yeah.
And
Yeah.
is that what is the word I'm trying to think of? Is it oh my gosh. I just forgot my whole question.
It's okay.
Sorry. Okay, it'll come back to me eventually, but we'll go to our next one for now. So the process lasts anywhere from
Typically, first time, 1 minute to a minute 30. Everyone has different sensitivity to the cold, and the object is to get to your cold point and maybe go an extra 30 seconds to a minute. And typically, I would say the average is about a minute 30 first time. The more you're coming, the more sessions you do, your skin, your body kind of adapts, and you go longer.
So how long does it take to see results from it?
That's a great question. We get that all the time. And it can be difficult to answer because, again, everyone's so different. But what we've seen from our experiences over the last couple of years has been usually from 6 to 10 sessions in close succession, you're going to start to see results. And close succession could mean every day. It could mean every other day, maybe 2-3 times a week, just when you're starting this. Obviously, it's not realistic for everybody to come every day unless you're a member of this gym here. But we want you to see you kind of a lot in the beginning in that first month, get the inflammation down, and then we can kind of taper off a little bit and come less.
Yeah, I mean, to get sciencey right, if you're dealing with inflammation, that's what we're targeting, right? So if you come in with this much inflammation, every time you're coming in, you're kind of doing this. So we want to see at the end of that, what do you feel like when you're here? And that's different for everybody. We tell you the honest truth. If you do a month of this, you're not seeing any results or anything, you gave it a fair shot, cryotherapy did not work for you. Typically, after a month, 95% of our clients fall in love with it or with this for a year or longer.
So how is one treatment enough?
I would say no. It's kind of, I always just compare it to the gym. I say, if you work out once, are you going to get into the shape you came in to get into?
Once again, who's coming in, right? Is it enough to really bring the inflammation down? No, not one, and you might feel really good afterwards. If you did a hard workout and you're coming after that, yeah, maybe one is enough because you're not going to be as sore the next day.
Yeah, it definitely depends on what you're using it for, but typically to get the results most people are looking for, we like them to try to commit to at least 1 month.
Okay. And how often can you do it?
You can do it every day. You can do it twice a day. You can do it. We had a client in Carmel that did it 3 times a day. That is not necessary, but it will not hurt you.
I would say, think of it like exercise, or like you're a gym member, right? You need to be consistent. Yeah. And then once you see results, go from there. Your schedule, what results you're seeing, how much you have to come to keep those results. Everybody's different. But we really have designed Glace to be a membership model. And that's because we want people to see results. And in Carmel, our best results were monthly members because they were consistent and they learned what it was doing for them.
So how is this compared to like an ice bath?
Ice baths suck. No, having said that, they suck because they don't feel good. They work.
They hurt.
Ice baths, they do work. If you're doing ice baths, good for you. I'm a fan. If I didn't have cryotherapy near me, I would say do ice baths a lot. They're going to get your inflammation down. This is going to do it even better, and it's going to feel way easier, way quicker. Ice bath, 30 minutes, tub full of ice. You need a lot of ice to get the temperature cold, all the way to your neck for 30 minutes. This is 1 to 3 minutes, completely dry. When you get out, you can go do anything. You do an ice bath, you're probably done for the day. So big difference.
So is there an age limit?
There really isn't. We've, for us, as far as how we operate here, if you're under the age of 16, we don't, unless you're a student athlete or you maybe have some injuries from that, or maybe you have an autoimmune disorder, those would be the reasons for somebody under 16 or 18 to use this. If they don't have any of those things, I probably would just say, no need. Yeah. But I think the youngest we put in was maybe 14, and actually she had an autoimmune disorder.
Oh, wow.
What about the oldest?
The oldest, that's a good question. I would say 85.
Yeah.
Yeah. 85.
Yeah. And loved it. It was incredible.
Yeah.
So what type of clothing do you wear during the cryotherapy?
So we actually provide everything here, as you guys just saw it. For men, you're going to leave your underwear on, and for women, bra top and underwear are optional. Then from there, we provide socks, gloves, shoes, and a robe. So we make it pretty easy for you, and that's all you need.
And how much does it usually cost, and is it covered by insurance?
This is my favorite part about what we're doing at Glace, and why some people think we're crazy here, because the average price for cryotherapy in the U.S. is somewhere around $600 to $700 for a month. Here, when we first started, we ran a promo for $99 unlimited. And we want to offer that same promo to anybody watching that wants to come in and use our services. So our normal price is $399, but we do enjoy running this promo so more people can come and do this, and it's more affordable. But $99, you can come and do cryotherapy every day. We have other recovery services that we offer, and they're all included on that package.
Can you tell us a little bit about the other things that you offer?
Yes, yeah. So one of our new ones that's been very, very popular is our Luma LED light therapy. So that one's going to be really great for pain. On the other end, you can do facials with it, so a little bit of beauty there. But that works at a cellular level. And so we found about 2 treatments a week of that. It's just a light panel. You lay over the area of pain. Your skin has to be exposed, but we actually just set up a private room in the back. If anyone needed to lay down, use it on their back. We have a lot of people use it out here on their knee or maybe their elbow. Those sessions run between 15 to 30 minutes. Just going to feel a little bit of warmth. That's about it, but works really, really well from what we've seen. And then the other therapy we offer is called Normatec compression. So those are going to be sleeves. We have legs, arms, and hips. And those sessions, again, are about 10 to 30 minutes. And what that does is increases circulation to maybe poor circulated areas and breaks up lactic acid. So just another great recovery and wellness tool that we have here.
So can it be done on only certain parts of the body as opposed to your whole torso?
Yes, it can. We don't have that equipment yet, but we are thinking about bringing it to our business come spring or summer. I know that our franchise in Chattanooga, Tennessee has ordered one. So if you're in Chattanooga, Tennessee, around there, you can go do it there. But I think it's great. I think it's really good for people that aren't quite ready to do the whole body. And maybe you really have a specific area that you really need to focus on. You can do both whole body and localized. It's a little wand, and you can do a specific area, and it can be used on the face too, which I know a lot of females love that aspect.
Yeah.